Hello everyone, I am Dr. Pushpa Soni. First trimester in pregnancy. First trimester in pregnancy is one of the most important phase of pregnancy because during this phase the baby grows rapidly and organogenesis takes place during this phase. Organogenesis is all the organs of the baby are formed during this phase. Hence, this phase is very vulnerable to the baby as the baby is very small and most of the organs are forming. So we should avoid a lot of things during this phase, like infections. Infections which are caused because of undercooked or unwashed non-vegetarian food like meat, poultry, seafood, raw eggs, which cause a lot of infection like salmonella and listeriosis, which affects the baby and causes miscarriages, stillbirth, and preterm labor. Unboiled and unpasteurized milk also causes these infections. So hence they should be the milk should be well boiled and pasteurized before you have it. Some cheese, soft cheese, which is also made from this unpasteurized milk, should be avoided during pregnancy. Unprescribed medicines affect the organogenesis of the baby and the baby may have some congenital abnormalities due to this unprescribed medicine which affects. So you should have all pregnancy safe medicines during this phase. X-rays, smoking, alcohol, tobacco affect the baby adversely and cause congenital abnormalities in the baby. Even caffeine, if taken in a larger amount, like which is present in colas, or you have more than 2 cups of tea or coffee in a day, can cause adverse effects in the baby. A pregnant lady should have uh, freshly cooked food which consists of a lot of vegetables and fruits in her diet. She should avoid preservatives and additives in her food. She should also take adequate rest during her pregnancy. She should lie for at least 2 hours in the afternoon and 8 hours in the night on either sides so that the blood supply to the baby increases and the baby grows properly. She should also avoid traveling like bumpy drives on the road or long distance road travel should be avoided by her as it causes miscarriages. However, she can travel by train and airplane up to 34 weeks in case a pregnancy is uncomplicated. A pregnant lady should wear flat footwear throughout her pregnancy because in case she wears heels, she may trip. Even the litter of pets, in case somebody has pets at home, should not be cleaned by her. This causes toxoplasmosis and which affects the baby during this phase of pregnancy. In this phase of pregnancy, we usually prescribe some blood investigation and urine examination to be done, which consists of thyroid and sugar levels. These are very important. They need to be in the normal limits, or else they cause abnormal organogenesis, means they affect the organ formation, and a lot of congenital abnormalities are seen in this with abnormal sugar levels, especially. We do prescribe folic acid tablet in this phase because it reduces the effect of neural tube defects. In fact, folic acid should be taken by a pregnant lady preconceptionally so that the folic acid levels in her when she conceives are normal. They should not be low. However, in this phase, sometimes we do see, vomiting, nausea, which is very common. And most of the times, we can treat it by medicines. Very rarely, somebody who doesn't recover with the medicine, we may need, the pregnant lady may need admission for that. Last but not the least, the stress pregnant lady should be stress free and should be happy throughout her pregnancy to have good outcomes for her baby and herself. Thank you.